Bear, I just want to thank you for having the courage to speak out. There is a systemic poisoning happening, and we have to realize that.
This extensive exploration will reveal the hidden dangers lurking in our diets, the shocking statistics of related diseases, and actionable steps to combat sugar addiction. Sugar consumption in the USA. The average American consumes approximately 130 grams of sugar daily, more than triple the recommended amounts set by health authorities. This overconsumption is largely attributed to the ubiquity of added sugars in processed foods and beverages. From breakfast cereals to sodas, the American diet is saturated with sugar.
If you're addicted to sugar, it's sort of like you're in an abusive relationship. Sugar is addictive, it's pro-inflammatory, it steals, hijacks your brain to need it in order for you to feel normal. I want you to begin to think of it as the enemy. It's really one of the weapons of mass destruction when it comes to your health. If you're looking at that cupcake and go, oh, I wish I had it, you got to work on your mindset.
Effects on the brain and behavior. Dopamine and addiction. Sugar triggers the release of dopamine in the brain, creating a rewarding sensation similar to what is experienced with addictive drugs. This response can lead to habitual overconsumption, as the brain craves the pleasurable effects of sugar, setting off a cycle of addiction. Cognitive function and mental health. Chronic high sugar intake is linked to impaired cognitive functions, including memory deficits and decreased learning capabilities. Moreover, studies suggest a connection between high sugar consumption and an increased risk of developing depression and anxiety disorders. The mood swings and energy crashes associated with sugar highs and lows exacerbate these mental health issues, leading to a negative feedback loop. Diseases associated with sugar. Obesity. One of the most visible consequences of excessive sugar intake is obesity. Sugary foods and drinks are calorie-dense yet nutritionally poor, contributing to weight gain. Obesity, in turn, is a significant risk factor for numerous other health conditions. Type 2 diabetes. The relationship between sugar and diabetes is well documented. High sugar consumption can lead to insulin resistance, a precursor to type 2 diabetes. As insulin becomes less effective at managing blood sugar levels, the risk of developing diabetes increases. Heart disease. Sugar contributes to heart disease through various mechanisms, including increasing triglycerides, lowering HDL, good cholesterol, and promoting inflammation. These factors collectively elevate the risk of cardiovascular diseases. Non-alcoholic fatty liver disease, NAFLD. Excessive fructose, a type of sugar commonly found in sweetened beverages, is particularly harmful to the liver. It can lead to NAFLD, a condition characterized by fat accumulation in liver cells, which can progress to more severe liver diseases over time. Mortality and sugar. Sugary drinks alone are estimated to contribute to approximately 180,000 deaths annually in the USA. This staggering number underscores the deadly impact of high sugar consumption on public health. The fatalities are often due to complications from obesity, diabetes, heart disease, and other related conditions. The nature of sugar addiction. Comparison to drugs. The addictive nature of sugar can be compared to that of drugs like cocaine. Both substances stimulate the release of dopamine, leading to addictive behaviors. This comparison highlights the significant challenge in overcoming sugar addiction, as the brain's reward pathways are deeply affected.
You find sugar in practically everything, right?
Everything. And there are 40 different names for sugar. And so when people read the label, they're meant to confuse you. So high fructose corn syrup, people go, oh, probably shouldn't have that. But fruit nectar, it's like, oh, well, that sounds good for me. Or fruit juice concentrate, well, that must be good for you. And fruit juice is not good for you because it's loaded with sugar.
Look at this. You got brown sugar, corn sweetener, lactose, cane crystals, honey, cane sugar, dextrin, corn syrup, fruit juice content, crystal dextrose, apple juice concentrate, agave nectar. These are just all other names for sugar, right?
Other names for sugar. And that's why we are fatter and sicker than we've ever been in human history.
How to overcome sugar addiction. Awareness and education. The first step in combating sugar addiction is awareness. Understanding the impact of sugar on health can motivate individuals to make healthier choices. We and many well-known experts like Dr. Eric Berg, Dr. Phil McGraw, and Dr. Thomas Seyfried work intensely to make people aware of sugar's impact on their health. Dr. Eric Berg, expert in health and nutrition, particularly ketogenic dieting and intermittent fasting. Dr. Phil McGraw, expert in psychology and personal development, primarily through his work as a television psychologist. Dr. Thomas Seyfried, expert in cancer biology and metabolism, with a focus on the ketogenic diet as a potential treatment for cancer. Reducing sugar intake gradually helps minimize withdrawal symptoms. Start by cutting out obvious sources of sugar, such as sugary drinks and snacks, and slowly reduce the amount added to foods and beverages. Healthy substitutes. Replacing sugary foods with healthier options can satisfy cravings without the negative effects. Fruits, for instance, provide natural sweetness along with essential nutrients and fiber. Hydration. Staying hydrated can help manage sugar cravings, as dehydration is often mistaken for hunger or sugar cravings. Regular exercise. Physical activity boosts mood and energy levels, reducing the need for sugar as a quick pick-me-up. Exercise also helps regulate blood sugar levels and improve overall health. Support systems. Seeking support from friends, family, or support groups can provide encouragement and accountability. Professional help from a dietitian or therapist may also be beneficial.
The USDA does not have a recommended amount of cigarettes. They don't have a recommended amount of alcohol for people to drink. We should not be recommending what, by all accounts, from every DSM addiction and drug ranking classifies as a drug, no nutritional benefit. We do not need added sugar, and I think it's really shameful, again, that we recommend this to kids.
That's why you say an orange is okay, orange juice, not okay.
Whenever you unwrap sugar from its fiber source, it turns toxic in your body. We haven't talked about fatty liver, but fatty liver is skyrocketed in children. It's like you think of fatty liver with alcoholics, but it is now becoming another epidemic.
And you can see on the left here, as blood sugar goes down, ketones go up. And this is an evolutionarily conserved adaptation to food restriction. Bodies are not getting the carbs. We're going to start mobilizing fats, bring them to the liver, chop them up, make water-soluble ketone bodies, and these are going to go to the tissues. And on the right, the blood sugar goes down, the size of the tumor goes down. The higher the sugar, the faster the tumor grows. The lower the glucose, the slower the tumor grows, right? So the higher the sugar, the faster your tumor grows. The lower the sugar, the slower your tumor grows, right? So if you want your tumor to grow fast, get your blood sugar up as high as it can get.